My name is Mike Skinner. I'm a firefighter paramedic. My experience with mental health in the workplace has been an up and down challenge. I've been a firefighter paramedic for 28 years. I started in a time when mental health really wasn't a conversation. I've talked about this before. I never really lived in a suck it up culture, but I certainly lived in a culture where we didn't speak openly about mental health. When I started in the city of Edmonton, and I'd gone from a small town to the big city, and so the exposure to traumas was now coming faster and more frequently than it ever had. Even though I realized probably around the 10-year mark of being career that I was having issues, I had become so insular and so used to telling myself that I was okay that that was how I was managing. I had always felt like I had a lot of resiliency. People would still say that I was a mentor and that I was a good paramedic and a good firefighter, and I was getting the job done, but I personally wasn't feeling that sense of satisfaction, and I wasn't feeling a sense of purpose in doing the job. And so I found that as that started to culminate on top of the unresolved traumas, I was becoming very detached. It took me the first 20 years of my career to even utter the words that I was having a mental health problem. I knew it. I just didn't want to admit it. And so because I had suppressed it for so long, I didn't understand where it had taken me. I found I was becoming very isolated. I was certainly becoming very bitter, and it had gone to the point where not only was it affecting my environments, but it was affecting a lot of my relationships. Friends that I'd had for a long time had stopped coming around. I didn't know why. Again, my attitude was it wasn't my problem. It must be them. It certainly affected my marriage, and even more so, it affected the relationship with my kids because I wasn't present, right? I would come home and I was trying to just manage what I had done for the last 14 hours. I described it once as being like a trauma washing machine. You get thrown into this thing and just get slammed around and run through the ringer. And then you would just sort of sit in there and never be clean, never get dried. And so that's for years, that's how it felt. I think one of the things that organizations need to do is they need to look a little bigger picture. We need to have resiliency training for our staff members. We need to be connecting in a meaningful way to community resources. What a lot of my peers have told me over the years, and I believe this as well, is that the less onerous we can make it. So if I don't have to fill out a ton of paperwork, if I don't have to make an appointment, if I don't have to worry about, a schedule, and I can find something that will support me, I'm more likely to go to that and use it with more frequency. So I think organizations need to look at creating complex relationships with other organizations like CMHA or programs like OSI-CAN to offer their employees something that maybe the organization can't. OSI-CAN is a community-based peer support initiative that was created to support veterans and first responders within their own community. So, in mental health, we talk about holding space. OSI-CAN, when it was created, felt that it was very important to have something in someone's own community. I think the sooner that we teach mental health literacy and the sooner that we offer meaningful resources to people, the more likely they are to understand what's going on and to use those resources. And at the end of the day, as an organization, that's an incredible benefit to you because you're going to get more longevity out of your employees. You're going to get better productivity just through that support. The last thing you want to do is invest in an employee and then lose them forever because their mental health, it challenged them to the point where they weren't capable to be part of your organization anymore. One of the things I understand from my own experience is there was a time when I thought I was shouting out loud about the fact that I was having mental health issues, when in fact I wasn't. I wasn't articulating it properly so that my employer understood where I was at. And so In building that psychologically safe workplace, that needs to include things like peer support, organizational peer support, um, uh, better literacy around mental health. Creating a psychologically safe workplace is incredibly important.